Hi, everyone, and thank you so much for joining me. My name is Dana DeGaulle, and today I want to talk about something that always doesn't get enough attention in medicine, the gaps in traditional care that can delay and sometimes prevent recovery, especially in complex or chronic infections. This isn't about blaming doctors, hospitals, or science. It's about shining a light on places where the standard model of care sometimes runs out of tools and what we can do to bridge that gap so patients can heal fully. When you're treated in a traditional medical setting, the approach is often built around a specific playbook. Diagnose, prescribe, operate if necessary, and repeat until symptoms improve. That model works for many acute conditions, a broken bone, strep infection, a gallbladder that needs to come out. But when you move into the territory of chronic infection, reoccurring illness, or conditions that don't respond the way textbooks say they should, this model starts to break down. Why? Because traditional medicine tends to focus on managing the immediate threat, not necessarily supporting the entire system that has to do the healing. For infections, that usually means antibiotics, surgeries, or wound care. All important, but if the body isn't in a state where it can partner with those interventions, progress stalls. Let's talk about a few key areas that often get missed, areas where gaps in traditional medicine show up. First is nutritional deficiencies. Many patients walk into hospitals already depleted, low vitamin D, zinc, iron, magnesium, protein, all critical for immune function and tissue repair. Yet in most hospital settings, nobody checks. A patient can be on IV antibiotics for weeks, but if their immune system doesn't have the raw materials it needs to regenerate, healing is incomplete. Gut health. And this one's huge. Antibiotics save lives, but they also disrupt the microbiome, which is a large percentage of immune resilience is built. Standard care rarely addresses gut restoration. That means patients often leave treatment more vulnerable than when they entered. Third is immune system dysfunction. Traditional care tends to look at immune systems as on or off. You either have an immune deficiency or you don't. But in reality, immune function operates on a spectrum. Stress, trauma, chronic illness, and environmental exposures all shift that balance. Supporting immunity isn't as simple as prescribing antibiotics. It's about rebuilding the system that fights alongside them. Fourth is whole person stress load. Emotional and psychological stress suppress immune function. Financial stress, fear of relapse, isolation, all of this impacts recovery. Traditional care rarely has the bandwidth to address this, but patients live inside it every single day. The real consequences of these gaps. When these gaps go unaddressed, patients often get stuck in a revolving door. They're treated with the same tools again and again, but the infection or illness comes back. They're told they're non-compliant or resistant, or even that nothing more can be done. In my case, I lived this reality: multiple surgeries, powerful antibiotics, aggressive treatments, and yet my body wasn't winning. Standard care did everything it could, but it stopped short of what my system truly needed to heal. This isn't unique to me. I hear from patients all the time who are in the same cycle, treated for the infection or condition, but never supported as whole human beings. So what do we do about it? The answer isn't throw out traditional medicine. It's to bridge the gap between acute intervention and long-term recovery. That's where integrative and functional medicine come in. Let me give a few practical examples. Nutrition testing and support, checking for deficiencies in things like vitamin D, B12, zinc, or protein, and then restoring them. Gut restoration protocols, using probiotics, prebiotics, and diet strategies to rebuild the microbiome after heavy antibiotic use. Detoxification support, helping the body clear toxins and reduce inflammatory load so the immune system isn't fighting on two fronts. Stress and emotional resilience practices, counseling, mindfulness, community support. These aren't soft add-ons, they're immune interventions. When patients receive this kind of care, recovery just doesn't mean survival. It means restoration. It means getting your life back. The real solution is collaboration, conventional and integrative medicine working side by side. Surgeons, infectious disease doctors, nurses, nutritionists, functional medicine providers, mental health professionals, all bringing their expertise to the table. When we break down the silos and stop pretending that one discipline has all the answers, patients benefit, outcomes improve, and we start closing the gaps that have left too many people struggling. So here's the question I want to leave you with. What if recovery isn't just about removing the infection, but about restoring the person? What if instead of asking, did the antibiotic work, we also ask, does the patient system have what it needs to rebuild? What if we measured success not only by survival rates, but by resilience, by quality of life, by freedom of relapse? The shift in thinking could change the way we approach not just MRSA, but chronic infections, autoimmune conditions, and complex recovery across the board. To my fellow patients, if you're in the fight, don't lose hope. If you feel like you've hit a wall, know that your body is capable of more than you've been told. It may just need a different kind of support. To healthcare professionals, I'm inviting you to stay curious. Ask the extra questions, consider the whole person, not just the infection. Partner with colleagues in nutrition, functional medicine, and mental health, because your patients want more than survival. They want a life worth living. Thank you for letting me share this perspective. Together, I believe we can close the gaps in care and create recovery stories that don't just end with the infection is gone, but with the person is whole again. And don't forget, a healthy person has 1,000 wishes and a sick person only has one. At the end of the day, we all want to have our 1,000 wishes and continue living the life that we always dreamed we would have.